Back surgery. It's one of the biggest, most intimidating medical decisions a person can face, right? But what does the science actually say about it, especially for something as common as a herniated disc? Well, in this explainer, we're going to dive deep and decode the research to figure out when it works, when it might not, and what you really need to know.
So why are we talking about this? Because this isn't some rare niche medical problem. We are talking about a type of pain that is a near universal human experience, something that will affect almost every single one of us at some point.
And the numbers, they're just staggering. I mean, check this out. Estimates show that up to 90% of the entire population will experience low back pain in their lifetime. It is a truly universal condition.
Okay, so back pain is super broad. What we're really zeroing in on today is a very specific cause, lumbar disc herniation, or LDH for short. Now, the best way to picture this, think of the little discs between your vertebrae as jelly donuts. Seriously, a herniation is basically when some of that jelly filling pushes out, and when it presses on a nerve, that's what causes that awful, sharp, radiating leg pain we call sciatica.
And this brings patients and their doctors to a huge fork in the road. Do you go with surgery, or do you try what's called conservative care? This is the central dilemma the research really tries to answer.
So, what are the options? Well, on one side, you've got surgery. This is usually a microdiscectomy, where a surgeon goes in and removes that little piece of disc that's pinching the nerve. On the other side, we've got conservative care. And that's really a whole toolbox of non-surgical stuff. Physical therapy, meds, injections, all designed to manage your symptoms while your body, hopefully, heals on its own.
So, which path is better? Well, if we're talking about the short term, the evidence is pretty darn clear. A big meta-analysis found that in those first 6 to 8 weeks, surgery gives you significantly faster and greater pain relief. And for someone in pure agony, that is a huge deal.
But, and this is a big but, when you zoom out and look at the long term, say 1 to 2 years later, something really fascinating happens. That early advantage from surgery, it's pretty much gone. The outcomes for both pain and disability become nearly identical between the folks who had surgery and the ones who stuck it out with conservative care. It seems like a lot of the time, the body just finds a way.
However, you might be thinking, well, I'll just wait it out then. Not so fast. The story doesn't end there. The data showed this really critical exception to the rule, and it completely changes the game for a specific group of people. And that exception is for those dealing with chronic pain.
Now, chronic is the key word here. The research defines this as sciatica that's been hanging around for more than 16 weeks. And for these folks, the script totally flips. The benefits of surgery weren't just faster, they were substantial and they were sustained. We're talking much better outcomes for both pain and disability even a full year later. That long-term catch-up we just talked about, it just doesn't seem to happen for this group.
And just so we're clear, when we say surgery, the research really confirms that the discectomy remains the gold standard. It just consistently outperforms other, less invasive options when you're looking for a definitive fix.
Okay, so the research tells us what the best surgical option is. But that brings up the next massive question: when? If you do go for surgery, does it really matter how soon you get it?
To put it as simply as possible, does it actually pay to be early? Is it better to get the surgery done sooner rather than later?
And the answer, you've probably guessed it by now, is it's complicated. It really depends on how long you've had symptoms. For the acute cases, so under 16 weeks, the evidence for faster pain relief is kinda murky. But it does clearly lead to better disability scores, which means people get back to living their normal lives faster. But for chronic cases, man, the answer is crystal clear. Early surgery gives a definite and lasting benefit for both pain and disability.
All right, let's switch gears for a second and talk about something super practical. Something on everyone's mind when they go through this: getting back to work. There's a lot of anxiety around this.
There's this idea that's been around forever, a real fear for both patients and even some surgeons. It's the belief that rushing back to work too soon after surgery is a huge risk factor for reherniating the disc, which often leads to people taking way more time off than maybe they need to. So what does the actual evidence say? This is a huge myth buster, folks. The review found zero evidence to back this up. The data is clear. Getting back to work early after surgery does not lead to worse outcomes or a higher risk of it happening again.
Okay, we've gone through a ton of data here. Surgery versus conservative care, the timing, getting back to work. So what's the bottom line? How do we put all of this together for the ultimate takeaway?
Let's just boil it all down. 1. Surgery gets you faster relief for new, acute pain, but things tend to even out over the long haul. 2. If your pain is chronic, the benefits of surgery are way more clear and they last. 3. The best time for surgery? It totally depends on your specific situation. And 4. That fear about going back to work too early? The evidence says you can probably get back to your life sooner than you think without adding risk.
So you see, the big conclusion from all this research isn't a simple yes, get surgery, or no, don't. It's not a destination, it's a process.
And what is that process? It's something called shared decision-making. It's you and your doctor on the same team. Step 1, you have to understand the evidence, which, hey, that's what we just did. Step 2, you've got to know your own symptoms. How bad are they? How long have they been there? And step 3, you take all that knowledge, you walk into your doctor's office, and you have a real conversation to figure out the right path for you.
So I want to leave you with this question to think about. Now that you're armed with all this evidence, what questions would you ask your doctor? What's the most important piece of the puzzle for your decision? Because that right there, that's where the real power of this research is. Thanks for digging into this with us.